Capitalization is one of the basic skills in English language. However, when it comes to medical topics, it can be quite confusing. In this video, you'll get all the details you need in using the uppercase and the lowercase in OET writing. Now, let's move to the first rule. This is one of the common rules in English. That is, you have to use capitals at the start of your sentence. Now, you all know this. However, there's a huge tendency to make mistakes here, especially when you're using the letters which have the same formation for the upper and the lowercase. For example, C, S, P. So, when you're using these letters, please be more conscious so that you won't make mistakes. Now, let's move to the second rule. That is, use of capitals with people. Now, you also know this rule as well. You have to use capitals whenever you're naming a person. This means that you have to put capitals with the name of the person along with the title. Mr. Smith, Nurse Johns. Now, you also have to put capitals whenever you're mentioning a job title. Well, Chief Surgeon, C and S should be in capitals. Or eye specialist, E and S should be in capitals. But you don't have to put capitals when you're mentioning a job. For example, doctors, nurses. You have to put these words in lowercase. Now, let's move to the third rule. That is with places. Again, it is one of the common rules in English. This means that you have to put capitals with the names of places which includes the address. Yeah, you got to use capitals with the names of the places inside the address. For example, 18 George Street. G and S should be in capitals. And let's move to the fourth rule. That is with institutions. When you're naming an institution, it should be in capitals. For example, the patient was admitted in Green Valley Hospital. G, V and H should be in capital. However, if you're mentioning hospital alone, it should be in small letter. He was admitted to hospital. H should be in small letters. Now, let's move to the fifth rule. That is with medications. Yes, in medications, you have to use capitals whenever you're using brand names. That is, name given to a medication by a company. Well, I'll give you a few examples. Panadol is a brand name. Lasix is a brand name. Diabex is a brand name. Cenimet. For all these medications, make sure that you put the first letter in capitals because it is a proper noun and the name has been provided to the medication by a company. But if you're using a generic name or a name of a chemical composition, you got to put it in lowercase. For example, furosemide, metformin, carbidopa and levodopa, paracetamol. Well, now let's move to the sixth rule. That is, use of capitals with body parts. Well, you don't use capitals whenever you're mentioning a body part. Maybe the hand, head, eyes, you should put it in lowercase. This is because body parts are considered as common nouns. Let's go to the next rule. That is with disease condition. In disease condition, whenever you're using ephonims, that is, name of a disease condition that starts with a person's name, you always should make sure that you start with capitals. For example, Alzheimer's disease, Down syndrome, Cooley's fracture, Crohn's disease. All these disease conditions should start with the capital letters. However, regular disease condition should go with the lowercase. For example, depression, type 2 diabetes mellitus, hypertension. These disease conditions should go with the lowercase. Lastly, with procedures. Well, when you're mentioning procedures or surgeries in your letter, put it in small letters. For example, X-ray or total knee replacement surgery. All these should be mentioned in lowercase. Now, you must have clearly understood on where to put the uppercase and the lowercase in your OET writing. Keep this in mind whenever you're doing a letter and things are going to be much more easier while you're using capitals in your letter. With that, thank you.